We talk about the great benefits of AI, but the challenge there is they're automating denials, right? And prior authorizations. And patients are like, wait a minute, I can't get my medication now. Do you see a way path forward, from where the economics of healthcare can benefit patients for the better?
It took years to get to where we're at. I don't think there'll be a quick fix. You can't just pass one piece of legislation. I think AI is going to be great in identifying cost structures. There's a lot more administrators than there are providers. And I think AI is going to be great in identifying, hey, you have redundant jobs for X, Y, and Z. So I think that will help reduce the cost of overall for healthcare providing. Now, whether or not they pass that discount on to their patients, that's another question. I think more than likely what's going to happen, especially under this administration, is that...
Hey, everyone. Welcome once again to Medical Practice Success Secrets. I'm your host, Theo Harvey. And I'm super excited about another interview I have today with Dr. Zan Hussain. How are you today, sir?
Good, my friend. How you doing?
Wow. If you don't know Dr. Zan Hussain, he is a social media influencer, but more importantly, he's an anesthesiologist that really cares about providing the latest and greatest information to patients and other practitioners out there in the social media world. And so we thought he'd be a great person to speak on today around some of the exciting things he's doing in his space. And more importantly, how you can think about it when you're working with your patients or collaborators, especially when it comes to anesthesiology. So I want to get right to it. One of the things that we saw in the 2023 Stanford study says about 66% of hospitals in the U.S. plan to implement artificial intelligence or AI, especially in their clinical decision-making processes. How do you see AI transforming anesthesiology in terms of real-time monitoring and predictive analytics?
So I had the opportunity to look through that study. I think, or look through those results of that poll. 66% for me, I think, is way too low. It should be 100%. Every single hospital, every single healthcare facility should implement AI, not necessarily to take other people's jobs, but to kind of enhance output. Specifically in the anesthesia and surgery realm, there are a couple areas that I think optimization would be huge. One, surgical time optimization. Now, most people know that the hospitals make most of their money from surgeries and procedures. That's just the unfortunate situation that we're in with healthcare today. It's a procedure-based reimbursement type of setup. So because of that, you have to optimize flow through the operating rooms, because the operating rooms generate somewhere between 60 to 70% of all the revenue inside the hospital. So specifically for the anesthesia and surgical realms, I think optimization of OR scheduling and better throughput, if that makes sense, would be the number one easiest low-hanging fruit for AI to kind of help understand, which proceduralists, which surgeons take longer, which ones are faster, how to, schedule individual surgeons in one room and optimize the schedule. So that's kind of the easiest, lowest hanging fruit. Now, in anesthesia specifically, I think AI will be fantastic when it comes to predicting potential complications that happen during the surgery. So let me just break it down easily. Like if you are losing a decent amount of blood, but you have no idea as an anesthesiologist, you just look at the canister to see how much blood is in there. But if there's any sort of AI algorithm that can look at blood pressure variation, stroke volume variation, pulse ox variation, they can kind of predict ahead of time that, hey, more than likely you're going to lead to hypotension or going to lead to low hemoglobin or whatever it is. If they can give some clues or some insight into what's going on with the patient based on whatever algorithms they come up with, I think that would be a fantastic first step for anesthesia when it comes to AI. But more likely, it's a couple of years away. I think that the lowest hanging fruit, like I said earlier, I think is OR optimization, and it's probably the biggest of the pie. Anesthesia specifically, I think AI will help with outcomes, but for monetization, I think AI will help a lot when it comes to surgical optimization.
I like that, how you thought about the business aspect of it, because you're right. That's a big revenue driver for a lot of hospitals, those procedures. And if you can optimize scheduling and get the most efficient individuals there, then you can definitely make sure you're optimizing the usage of that OR room. And so how does that affect, perfusionists, right? They're the ones in there kind of helping the anesthesiologists, with running the lung machines and all that, from my understanding. Do you feel like, they could be more efficient with AI, artificial intelligence, as they're kind of, working through that process?
Yeah, so traditionally, a perfusionist inside the operating room is usually somebody that's involved in cardiac bypass or perfusion for blood flow during cardiac surgery. I think that would I don't know the specifics when it comes to how they operate their machines, but I imagine a layer of AI in there to help them optimize electrolytes or blood counts or those kind of things. It would decrease the burden that's on those perfusionists in that instance. But I think in the entire realm, Theo, there's so many different variables. When you look at an actual surgery, of which a lot of people are trying to calculate a lot of numbers inside their head, or calculate a lot of potential risks when it comes to the patient, the type of surgery, the type of implant they're putting in, whatever it is. There's a lot of moving parts. I think AI could help simplify that and give a little bit more guidance to not only the perfusionist, but maybe the nurse, maybe the anesthesiologist, maybe the surgeon itself. You could have a little ear plug in to say that, hey, this is happening in the background, or whatever it is. There's so many opportunities out there to not only better patient care, but increase throughput through the operating room and generate the most revenue, but also provide safe surgical optimization. I think there's limitless potential when it comes to AI. Specifically, but for the breathing machines, like the question that you asked, a lot of the times that's the anesthesiologist doing that. And yes, you're right. There's a lot of nuance to the calculation of how much oxygen you're supposed to receive, how much tidal volume you're supposed to receive, what is the goal end tidal carbon dioxide that you should be striving for, and even the anesthesia gas that we use to keep you asleep. How much do you have to give? How much is adequate? A lot of that right now is on the shoulders of the anesthesiologist to kind of go from what their training is, but there's not a lot of specific parameters when it comes to anesthesia itself.
I think I mentioned this before the pod. One of my best friends is an anesthesiologist, and he told me that a long time ago. He said there's a lot of, obviously you have case studies and you do, quote unquote predictive analysis. Basically, you look on the case study and look at the person, and based on past studies that you've done before in cases, you make estimates, right? Smart estimates, of course, not just the back of a napkin estimate, but of how much that you need to provide to the patient to keep them under during surgery and things like that. So I'm just curious, to your point, can AI make that even more efficient, right? So especially for the younger anesthesiologists, so they don't feel like, oh, I need to go back to my case studies and look at we have a 40-year-old man, is 200 pounds, doing the calculations. Do you think AI can be well, maybe there are tools now, right, that do those calculations a lot faster and more efficiently. Is that something that you're seeing AI can kind of impact that a little bit faster, especially for the ones who haven't seen enough cases yet to make those judgments?
Oh, the bridge, the knowledge gap, I think it's going to be fantastic in every field in medicine. I think experience is a lot that we rely on. What experiences we have as attendings, as trainees, what we learn in the surgical realm when we're first starting out. It's like drinking out of a fire hose, essentially. So I think AI will help bridge that gap for sure, but also providing real-time analytics by being able to kind of back test it against, there's been 100 people that have had this type of knee replacement with this, and this type of medications. Yeah. There is a 30% chance that you're going to run into this complication. So you should probably think about it. All the others are less than 5% or less than 2%. So it can help risk stratify in the anesthesia realm. But I imagine it can you could probably apply that to any patient in any hospital that, hey, if you're coming in for, kidney issues, you have a risk stratification. They give you the, these are the potential outcomes. This is what you should look for. Now, I don't think that they're going to have robots doing, anesthesia or surgery anytime soon, but decreasing the burden of information and decreasing the burden of anxiety or burden of questioning or anxiety when it comes to each patient. 100%. I think AI implementing there, even a simple tool that can kind of just give you a predictive analysis on, hey, this is probably what's going to happen during your surgery. This is what you should look out for. That would be a total game changer because it would probably decrease mortality, morbidity by a significant percentage amount. Now, I know a couple companies are actually out there doing that right now when it comes to blood pressure and oxygenation and hemoglobin inside the operating room specifically. But I imagine that every healthcare company is going to do it in, dialysis and bronchodilation and whatever cardiac stenting. It's going to be across the board, 100%.
Yeah, we're looking at AI, right, to kind of just help with patient engagement. Like, so you didn't do your blood pressure cuff, why not? And just keeping them engaged in that process remotely so that they can kind of manage their chronic conditions with what we do. But when you kind of look at, those life or death type of situations, you're right. You probably don't want AI meddling with that and making decisions, because I think ultimately, there's a human element of, making decisions based on, the patient. And ultimately, if you're a patient, you want to You want a human being that has empathy, right? That can make better, decisions. That, because always the question I'm sure you get, or any doctor gets, is like, if you were a patient in this situation, what would you do? And so I think that gives, patients some assurances that, the numbers, the risk, but this is the best choice of I would do for myself or my family members. And so I think that, the human element is so important for that bedside manner, in addition to, right, the data. Real quick, I mean, this is kind of off the beaten path, but it just kind of came to my mind as we were talking. When you talk to patients, I know there could be some irrational fears about waking up doing surgery or things of that nature. I mean, what's the data tell us, right, when it comes to those scenarios of patients waking up in the middle of surgery, and how can you, assure some people who are listening to this podcast that, it's a very rare occasion.
So numbers wise, it's about 1 in 6,000 of patients having what they call as recall, which means you remember some portion of the surgery. It also kind of depends on what type of anesthesia you're getting. When you have general anesthesia, you're in a lot deeper state of anesthesia as compared to what they call as conscious sedation, or just sedation in general. And that is for like colonoscopies or those kind of procedures when you don't need to have a breathing tube or a breathing machine. There's a higher likelihood, I don't know the percentage of numbers off the top of my head, of somebody waking up during a colonoscopy with an anesthesiologist. Now, there's two, so this goes into nuance, but there's two different ways to get colonoscopies. You can get it with an anesthesiologist, or you can have the proceduralist just give a few sedative medications. And most of the time, there's a higher level of recall. But to answer your question specifically, it's about 1 in 6,000. And of that, usually people remember the tail end of the surgery. Waking up during the surgery is pretty rare. And, AI could probably help with predicting that as well. But right now, it's super rare. And most of the time, it's just that the anesthesia kind of was ended a little bit early, and you remember the tail end when, they're cleaning you up or taking the breathing tube out.
Yeah.
Being awake during an operation is very, 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 very rare.
Yeah. Well, thank you for that assurance. Yeah, I had a colonoscopy, and it was. I never had it before, anesthesiology. So, I did the count back. Next thing I know, it was rolled out. I was like, oh wow, I don't remember anything. So yeah,
It's always better with an anesthesiologist.
Yeah.
Sure.
So I don't know if it was a specific one they put me on, but it worked wonders. So so let's go and pivot again a little bit into like your journey into social media. We talked about that before this pod. What made you get involved in it, number one, and then how is that journey going for you? And what do you see the importance as a medical professional of why it's important for you to be on social media? Talk a little bit about that.
Yeah, absolutely. So, like we talked about earlier, Theo, before we started, there was a lot of misinformation on online during COVID times. Everybody had more time to be on, their phones, and there was a lot of crazy ideas out there, far left and far right, that were a little bit not a little bit, way out of bounds. So I found an opportunity, and it wasn't by design. I didn't, I never grew up wanting to be an influencer or being in this type. I enjoyed videos. I enjoyed video processing and creating these type of setups and all that, but it wasn't a goal of mine. But when I got onto it, I realized that medicine had this kind of a veil or shroud of like secrecy in front of it, and people didn't really understand not only medicine but the business side of it. I mean, there was this blanket of like, you go to the doctor and you get a bill, and you have literally no idea why you're getting paid, why you're getting charged that much, what the actual costs are. Is it overcharge, undercharge? How does business of medicine work? And as a finance major in college, I always had kind of a passion for the business of medicine. So when I got into social media, I first, started off, majority of my stuff was just kind of explaining complex medical topics in a little bit of a simpler terms to help people understand that, hey, if you do this and that, you could theoretically improve your health just by substituting this type of meat for that type of meat, or eating this type of fruit versus that type of vegetable. So that was very enjoyable to me. And the response I got from a lot of people, a lot of messages, a lot of emails that said, hey, you told me that a blood pressure of 180 isn't normal. I went to my doctor, got it checked, and they told me I could have had a stroke. And so those kind of messages stuck in my mind. And I was like, oh, there's such a large gap when it comes to like what I know versus what the public knows. And just to shrink that gap a little bit and provide people knowledge on the outside, just to improve their day in and day out life, whether it's just maintaining your blood sugars at a normal level so you don't end up with kidney disease on dialysis, which affects so many people, and people don't take it seriously. Like, oh, my blood sugar is high, no big deal. Well, you don't understand that if you do that for 5 years, 7 years, your kidneys are going to be shot, and then you're going to be on dialysis, and the end of your life is going to be terrible. So the the window of opportunity was there, I guess, after COVID. And I started significantly after COVID. I didn't do it before or even during. I did it way after. But there was such a wide gap in knowledge for so many people, and it's been so fruitful because I've been able to make an impact in so many people's lives that I just enjoy doing it now. And now my focus is more kind of I do the educational portion of it as well, but I also kind of enjoy explaining the business background on shocking things out there. Whatever it is, even some of the most heralded medical advances, or sorry, medical politics out there, like even Obamacare, which I was a huge fan of when it came out. I didn't really understand the numbers behind it. Now I understand the numbers behind it, and I'm like, oh, it was actually kind of set up to help the insurance companies more than the patients. So there's so much things out there that gets spun in a way by the traditional media, and I'm like, oh, this there's actually another side to it. So I really enjoy that aspect of it, just shining light on different things that people are just shining light on different topics that help people think critically. So that's the enjoyable part of it for me.
Wow, that's insightful. I mean, I think you're right. We've talked to many doctors, during that kind of started during COVID. And that was the number one reason, was because of the misinformation, right? We have previous episodes. We talked to Dr. Assam, a cardiologist, and really wanted to kind of educate people on how to keep a healthy heart. Dr. Refi, who was helping patients with breathing issues and simple breathing exercises. So yeah, I think you're so right. I think we get a lot of other information out there from influencers who don't have the schooling or the background you guys do, and we listen to them. But then let's have the real professionals who have evidence-backed data to kind of support what they're saying is so important. But I would love to double click a little bit on the business side of it. I have an MBA as well, and just understanding. And I came from the technology side into healthcare, so obviously that's kind of my lens of reference. But the business side is so fascinating to me. Value-based care, right? Where we're going with it. I mean, do you feel like it's been successful, or the hot take is, it's not it's not being successful at all? And one of the big ones maybe we can talk about is just the kidney programs, right? There's a lot of money that went into that, and we recently saw some cutbacks in that space. So what are your thoughts, from the business side of healthcare?
Yeah, so it really depends on who wrote whatever legislation that's being affected. And value-based care, was the idea of it, made a lot of sense. I mean, you have a total package of money that you get for whatever issue you have when you go to the hospital, and then the hospitals kind of figure out how to delineate that. The part that a lot of, I guess, politicians or whoever wrote the law didn't see was that hospitals would realize that it's actually more profitable to be an insurance company than it is to be a hospital. So the backstop on that whole thing was that, hey, there should have been a separation between the two. There shouldn't be this type of vertical integration where,
Well, you mean everybody wanted to be Kaiser? Is that what you're trying to say?
Well, the Kaiser, United Health, what are the other big ones? Intermountain Health.
Yeah.
These guys are expanding like crazy. And the reason being is that, so the laws were set up in a way to kind of disadvantage physicians, because the marketing or the politics behind it was that if a physician is in charge of a hospital, then more than likely they're going to upcharge, or they're going to help their buddies out, and then there'll be kickbacks and all these things and then the data came out 5-10 years later, which came out and pretty much showed that if there's a physician-led, physician-owned hospital, you actually spend 30% less on healthcare costs, and you have better outcomes. And that's the thought process behind that, or the reason why it makes sense in my head, is because if a physician or a group of physicians or whatever medical leaders you have are in charge of a hospital, they're going to place a lot of emphasis on outcomes, and they're going to place a lot of emphasis on treating the patient, as opposed to hitting their numbers or whatever it is traditionally for MBAs or business owners when they own a hospital. And now you see not now, but during COVID, you saw private equity get into hospital ownership. And why was that? Is because there were massive subsidies from the COVID payouts from the government, and it was just free money. And so for a period of, I think, 3 to 4 years, every practice, every hospital was up for sale. And now that it's kind of flipped. If you saw recently, HCA had terrible earnings out. RadNet actually went under, and now they're selling it. That RadNet is the radiology owned private equity backed. And they own a significant portion of the radiologists across the country. So The idea of value-based care in my head made a lot of sense. It's just that they didn't really do the research for the backstops, and it pivoted the industry. And now the industry is focused. I would say the majority of hospitals out there are focusing on becoming insurance companies, as dumb as it's, and even the insurance companies are now vertically integrating. If you see, United Health is actually either it's the second or third largest employer of physicians itself, and it's not even a hospital, it's an insurance company. So they've bought so many practices and then they bring them into their own fold, and then you can charge less for the same care and keep more of the profit. So the idea of value-based care was fantastic. It's just like a lot of other things in today's day and age. The ideas are fantastic, the execution sometimes doesn't produce the results that you wanted.
Yeah, obviously, providing incentives for doctors to look at the outcomes, is definitely makes sense in practice. But you're right. I think what happened. You're right. Hospitals or bigger systems kind of what they do, these roll-ups, right? Get all these different practices, put them together, and now they have a huge referral network of patients that they can. You become basically a local monopoly. And then if you know anything about monopolies, you can charge whatever you want. There's no upper bound on limits or your rent.
You squeeze the little guys. You squeeze all the little hospitals, and they all go under. And you're seeing that across the country. Hospitals are going out of business, and they're being bought up by these mega.
Especially rural. We work with a lot of rural, organizations, and so they're struggling. Or you see, and healthcare has always been that struggle between independence, because doctors, highly educated, they can kind of put their shingle up and start whenever they want to, but they run against the economics of the hard fact of running a small business, just like anything. So when you have hospitals, I'm in the Georgia area, like the Piedmont hospitals, other ones come in, they consolidate, and then they kind of price you out. You have no choice but to become an employee at that point.
And then when you own I don't know about Piedmont specifically, but when you own the insurance company and the hospital, you can, and if you're the mega, like you said, monopoly in the area, let's just take, I don't know, Kaiser, for example. Kaiser can squeeze a lot of smaller hospitals, say, hey, if you don't do this, and this, or if you don't reimburse this, and this way, we just won't accept your insurance. We won't accept you, allow our insurance to go to your hospital. So then the smaller hospitals get squeezed on both sides. They have to pay higher for their physicians and providers, and they have to go to specific or accept specific insurance companies under certain conditions, and it becomes a lot harder to operate as a small business or a medium-sized business, and when you have giants in the field.
Yeah, do you see any way out of this? Obviously, we had that big tragedy that happened last year with the CEO of United Healthcare. The patients are getting hurt. And then obviously we talk about the great benefits of AI, but the challenge there is they're automating denials, right? And prior authorizations. And patients are like, wait a minute, I can't get my medication now. And so do you see a path forward, from your research, or just thinking about where the economics of healthcare can benefit patients for the better?
It took years to get to where we're at. I don't think there'll be a quick fix. You can't just pass one piece of legislation. I think AI is going to be great in identifying cost structures and almost like what's the word I'm looking for? Fluff in the system, I guess. There's a lot more people. There's a lot more administrators than there are providers, and I think AI is going to be great in identifying, hey, you have redundant jobs for X, Y, and Z person in this field and that field and this on this floor. So I think that will help reduce the cost of overall for healthcare providing. Now, that whether or not they pass that discount on to their patients, that's another question. I think more than likely what's going to happen, especially under this administration, is that healthcare is going to go private. I think Medicare, Medicaid, all these things will be outsourced as one giant lump sum of payments, and then it's going to be up to Blue Cross or United Health or Kaiser or whatever to figure it out. So they'll, instead of having Medicare and Medicaid being government programs, they're just going to outsource all. That's my estimation. They're going to privatize.
Well, isn't that what Medicare, Medicare Advantage programs, right? They're really private Medicare. So you see more of that is going to lean more of the Medicare. It's going to be.
I think they're going to outsource the whole department. Right now they have a department that outsources the department to United Health or they have an entire Medicare or Medicaid Advantage, like you said, but they have government oversight of that on their campus, on whatever campus is for Medicare. I think it's in Baltimore, but I'm not 100% sure. But I think that'll all be outsourced, and it'll just be one lump sum check that goes to these guys that say, hey, you insure all the people on Medicare in Minnesota or in
Mm,
Illinois. But that's just a guess in my mind. I don't think there's a quick fix to all this. I think the medical system is broken and it's heading toward, I mean, there's a reason why it's, 2.4 trillion or whatever the cost is per year for healthcare in America, which is insane compared to the rest of the world. But that being said, we get better care here than the rest of the world. In my opinion, we get much better care. You have much better researchers, much better physicians and surgeons and people that can take care of you here. And the quality of care is much better, but the cost of it is unsustainable. So there has to be some sort of kind of shift in the paradigm. What that is, I don't know specifically. My guess would be that they'd privatize it and let the insurance companies figure it out. Essentially, that would be my guess. But I don't want to see that happen. But I think that's what's going to happen. I was going to guess.
wow. Wow, this has been insightful. I love talking business of healthcare, so we'll do another part another time. But wow, this has been great and learning a lot. Dr. Hussain, where can everyone find you? What are you working on now?
Yes, I'm working on a couple AI projects. I can't say specifically what they are, but working on those right now. If anybody wants to find me, just put me into Google or search Dr. Zain Hassan, and you'll find all my socials come up. Usually, my like Instagram and Facebook is just my first name, last name. Just look for the blue check because I have a lot of copycats out there.
No worries. Well, hopefully, when you announce that, we'll check it out when you put it out there for social publication. So, well, thank you, Dr. Zain, for your time today, everyone. Look, this is what's happening now in healthcare as you start to build your practice and learn more. What we're here to do is show you what's happening in the new normal of healthcare. Thank you for your time.
Anytime.
Thank you for listening. If you like what we just talked about and you want to learn more, click either to the right or to the left, and you can find out more information about how we can help you this year.